This is from Debbie in Wareham, Massachusetts, who asks, with all the talk of measles in the news the last few months, should adults who have been previously vaccinated for measles get a booster measles shot? What do you think?
I think that's a good question from the viewer. Sometimes we get blood test immune status on folks to see exactly are they still currently immune. Sometimes that can be helpful as well.
Yeah. So basically, the CDC recommends that certain adults check their measles immunity. This is the official answer to the question. I don't know. Can you trust the CDC anymore? I don't know. I think you have to take everything with a grain of salt. But I did do a little. I didn't do a deep dive. I don't have time for deep dives. I do shallow dives. I've talked about that before. But you can call this the patented TN shallow dive. But basically, the CDC recommends that people should get a booster measles shot if they received an inactive measles vaccine between 1963 and 67, if they work in a healthcare setting or high-risk exposure setting, and have had only one dose of the measles. So if you work in a hospital, school, child care center, it might be something to consider getting a booster shot. If you're unsure of your vaccination status, or if you're traveling internationally. So if you're going to a place where measles is endemic, these are all good reasons. And as Dr. Hemrock said, you can ask your doctor to check your titer. This is a blood test that can be done. It's a simple test, antibody test. And if it comes back negative and you know you're going to be in a high-risk test and high-risk place, then maybe get a booster. Now, just because you have an antibody level that might be below what we consider a positive test does not mean you have no immunity to measles. If you got a shot before, you have some immunity, sitting in here somewhere. It just might not be optimal level of immunity. So if you got any of those indications, you're going to travel, you're unsure, you work in a high risk setting, probably a good idea to discuss this with your doc.